Hi, I'm Danielle.
Hey guys, I'm Sydney.
Hi guys, I'm Caleb. Today we are going to be presenting a study by Shapiro et al. Titled Maternal Diet Quality in Pregnancy and Neonatal Adiposity as part of the Healthy Start study. Today's presentation will be broken down into 6 parts. We'll give you some background on the subject area, provide you with the purpose and hypothesis of the study, what was done, what was found, and what the results mean for future research and clinical practice. In Canada, 25% of women of reproductive age are overweight and 19% are obese. As discussed in class, this excess adiposity can have large repercussions on both maternal and fetal health. In Hall et al., for example, they demonstrated that maternal overweight and obesity during pregnancy place neonates at an increased risk for obesity in later life. On the topic of the developmental origins of health and disease, Hopkins and Cutfield hypothesized a U-shaped relationship between offspring birth weight, which has been associated with the in utero environment, and the risk of adverse health outcomes in later life. In the past, interventions to help women lose weight prior to pregnancy so as to mitigate adverse offspring health outcomes have been difficult, specifically because not all pregnancies are planned. A new approach to mitigate health risk in the offspring would be to shift the focus from pre-pregnancy interventions to interventions actually during pregnancy. Let us consider the role of diet quality during pregnancy and its effects on the offspring. Literature suggests that dietary patterns during pregnancy are significantly related to birth outcomes, fetal growth, and development. Past research in this area has yielded inconsistent findings. Animal studies have shown that increased neonatal adiposity has been associated with high-fat diets, but these are findings that are inconsistent when replicated in humans. Considering individual macronutrients, Blumfield and colleagues have demonstrated a relationship between increased adiposity in the offspring and a maternal diet with a low protein to carbohydrate ratio. Whereas studies in the past have focused on specific macronutrient intakes, the present study will use a comprehensive assessment of diet quality called the Healthy Eating Index 2010 to measure the effects of diet quality on offspring outcome measures. With respect to offspring outcome measures, the present study will measure offspring body composition rather than specific growth parameters like birth weight and length. Compared to the latter, neonatal adiposity has been shown to be a better predictor of offspring long-term health outcomes. To our knowledge, no study has assessed the relationship between maternal diet quality using markers of offspring body composition such as adiposity. It was hypothesized that neonates with low diet quality during pregnancy would have increased adiposity compared to those born to women with higher quality diets. It was also hypothesized that diet quality modifies the effect of pre-pregnancy BMI on neonatal adiposity.
So as Caleb mentioned, this is a sub-study of the Healthy Start study, which looked at maternal environment and experiences on fetal growth and development. Mothers were excluded if they had diabetes, current multiple pregnancies, or other health concerns that could confound results. The final sample size, after further excluding women who developed gestational diabetes or who had infants born prior to 32 weeks of gestation, comprised of around 1,000 women. So essentially, the study took place in 3 research visits. The first visit was in early pregnancy, the second visit mid to late pregnancy, and the third visit occurred at the hospital post-delivery. At all 3 visits, surveys were administered regarding physical activity, behavior, and dietary patterns, and then fasting blood tests were also taken at the first and second visits. Additionally, the first visit included a demographics questionnaire, and pre-pregnancy weight and height were obtained from previous medical records at this time. And then lastly, in the third visit, fetal parameters were taken within 72 hours of delivery. So these included length, weight, head circumference, skin fold measurements, and then neonatal body composition was also measured at this time using air displacement plethysmography. So in terms of dietary assessment, these tools were used in addition to the dietary pattern questionnaires that I previously discussed. So the automated self-administered 24-hour dietary recall was used to determine what the women were eating throughout their pregnancies. 76% of the eligible cohort had at least 2 dietary recalls. Next, the data from the ASA-24 was used in the Healthy Eating Index to quantify a diet score. The Healthy Eating Index is a valid and reliable measure that breaks down diet into 12 components. These components include total fruit and vegetables, whole grains, fatty acids, and a few others. And then scores from each of the 12 components are then comprised into a total diet quality score out of 100. So in order to determine the cutoff for healthy diet in this study particularly, healthy eating index scores were compared to percent fetal fat mass scores, and a clear threshold of 57 was observed, below which maternal diet affected fetal fat mass. So in terms of results, women with poor diet were more likely to be overweight or obese, smoke, have a lower household income, as well as be younger mothers with shorter gestation periods. These women were also more likely to have had a greater amount of previous pregnancies and exhibited higher energy expenditures. And then results from the Healthy Eating Index showed that women with a higher quality diet, which was indicated by a score greater than 57 on the Healthy Eating Index, had higher scores for each of the 12 components of the diet, which can be expected. And then women who consumed a poor diet consumed greater amounts of energy from fats and saturated fats, and surprisingly, empty calorie scores were lower in this group. And then with respect to the offspring, poor maternal diet was associated with higher percent fetal fat mass, and this was found to be independent of maternal BMI. And then lastly, poor diet was associated with higher fat mass in grams, but did not have a significant effect on fat-free mass or total weight. So this just goes to show that the increase in percent fetal fat mass was due to an increase in fat mass itself rather than a decrease in fat-free mass.
The bottom line of our study is that poor maternal diet quality may increase neonatal adiposity independent of maternal BMI. The findings that poor diet quality is positively associated with infant adiposity intakes of total fat and saturated fat are characteristic of this poor diet quality, suggesting that negative effects of nutrients on neonatal body composition may be the result of multiple nutrients interacting. Further adjustment for gestational weight gain during pregnancy also found the maternal diet quality is independent of the aforementioned variable. Now to the strengths. By using the Healthy Eating Index 2010, this study was able to have a comprehensive understanding of the maternal diet, which allows us to understand multiple nutrients interacting. Previous work looking at maternal diet's impact on fetal growth outcomes has been unable to produce significant findings, possibly due to measurement inconsistencies and data collection. A similar study by Rodriguez-Bernal found that poor maternal diet quality did result in increased birth weight, leading us to the next strength of the study. By assessing body composition as opposed to just birth weight or other traditional measurements, our study was able to control for possible confounds and allow us to make a direct link between poor maternal diet quality and increased neonate adiposity. Additionally, this study is the first to have two data collection points during pregnancy. By assessing diet and behavioral measurements over the course of the pregnancy, it allows us to observe dietary changes and give us a more comprehensive view of an individual's diet and overall health change over the course of their pregnancy. Furthermore, this study is ongoing longitudinal cohort, so future results will be observing long-term health impacts of the maternal diet. Lastly, the self-report aspect. We've seen in previous studies that self-report measures have been shown to be more cost-effective and less prone to social desirability biases often seen in obese populations. One of the limitations we did identify for the study was its generalizability, as we are unable to compare these results to any other study that did not use the Healthy Eating Index 2010, and therefore future studies should employ the same dietary assessment tool going forward. Additionally, the 72-hour timeframe of neonate measurement means that this 72-hour period is critical in changes for neonate body composition, and therefore future studies should look to have a more specific timeframe in these measurements. Lastly, 76% of the mothers did complete 2 or more ASA 24s, but it would be better to have more information given that participants were asked to complete 6 over the duration of the study, and therefore future studies should consider increasing follow-ups with women to increase adherence to the protocol. So based off these results, our future direction big question is, can we find the perfect pregnancy diet? We believe based off these findings that the recommendations we could make could be universal to all BMI categories, as well as pregnancy nutrition going forward could be considered separately from maternal adiposity in impacting neonatal adiposity, as it could potentially have an additive benefit to interventions that are targeting pre-pregnancy BMI. As well, as we know, many pregnancies are unplanned, and therefore future work on maternal diet could help increase neonate health once conception has already occurred. More work is needed to understand the interactions of other nutrients on neonate adiposity, as well as more work using the Healthy Eating Index 2010 for a comprehensive understanding of maternal diet. Lastly, as we saw in class, timing with exercise could be very important, and more understanding on when to implement this intervention in time with an exercise intervention is needed. In conclusion, this study was the first to show that maternal pregnancy diet impacts neonatal adiposity independent of maternal pre-pregnancy BMI while using a standardized diet assessment tool. Future work building off the study's findings should aim to provide pregnancy diet guidelines and take into consideration future findings from this longitudinal cohort. Thank you guys very much. This is me, Caleb, and Sydney as babies in a flower pot, and here are all our references. We look forward to your questions.